Now recognizes Dr. Miller-Meeks for 5 minutes.
Thank you, Mr. Chair, and I want to thank all of our witnesses for being here today. And let me also say to all of those who lost loved ones during the COVID-19 pandemic, as a physician and a former public health director, we know that infectious diseases are something that we have largely tried to help, to assist with, and COVID-19 is one of those where we still don't even know the origins of COVID-19 and are still uncertain about transmission status with vaccination, but we know people with vaccines and boosters can still transmit the virus, so we still have some to learn. But one of the things I can say that we do know from the infectious disease and medical standpoint is that when you mix sick people with an infectious disease with well people, that you're likely to get transmission. And as we've heard from my colleagues today, it's clear that the governors in New York, New Jersey, and Michigan violated clear guidance and infectious disease protocols by issuing must-admit orders, which sadly led to thousands of unnecessary elder deaths. We already knew from the evidence we had from China that there was transmission in elderly people, that children rarely got ill. There was a question whether children would transmit the virus because they have a much better immune system. We knew that this group was the most susceptible group, and we already knew that there was guidance from CMS and from CDC in regards to admission status. Let me also say that the actions of these governors went against CMS and CDC guidance when they forced COVID-19 positive residents back into nursing homes, forced them to be accepted, and declined, and in sometimes actually tried to get them not to test the COVID-19 status. While the Trump administration was issuing guidance to attempt to protect this already vulnerable population, these governors showed carelessness and acted directly against the science. This is not political, it's scientific. For those of you who have children and have gone into a pediatrician's office, most pediatricians' offices will segregate out the well children from the sick children. And in fact, we did that with pathways into hospitals throughout the COVID-19 pandemic. Long-term care facilities have always been more vulnerable to infectious disease outbreaks for a plethora of reasons, but especially because they're primarily occupied by elderly people who have an already suppressed immune system. And this has remained true with COVID-19. However, carelessness and a lack of following the science led to worse outcomes than what was necessary. And I would say any public health director, state public health director, and I was one in Iowa, would have known that putting COVID-19 positive patients or patients who had not fully recovered from a COVID-19 diagnosis and admission to a hospital would put others at risk. When the population of caregivers are primarily younger, who may not get ill, it's possible they could bring in COVID-19 coming into a facility, but more likely introduced from ill patients who had poor immune systems and were more likely to transmit. So I believe that as we look back and conduct oversight of the COVID-19 pandemic, we should look at the importance of ensuring long-term care facilities remain a priority when it comes to allocation of resources, such as PPE and vaccines for situations such as when the pandemic arises in the future. And Mr. Arbeenn, I think you've spoken to this, but could you speak to the risk this presents to residents of nursing homes, and can anyone provide a good explanation for the inconsistencies and how we did in hospitalizations, in hospitals, acute care hospitals, and segregating patients, and then what was allowed to be admitted and mandated in New York, New Jersey, and in Michigan?
It felt to me, in my experience, being in the hospital system and in the nursing home system, that, and it felt to me, all the focus in the media and everything our former governor was saying was on the hospitals, not on the nursing homes. It felt like nursing homes were the orphan stepchild. There's just, I can't put it any other way. And yet, the nursing homes are where our most loved people are, our parents, our grandparents. Just nobody with common sense would have ever done anything like that. And what, 50 states, 45 states didn't do that? The 5 that did? From what I remember, and I don't remember the numbers, the outcomes were just so much higher.
And at a time when we prevented family members from being with those individuals. Thank you so much for your testimony. Mr. Chair, I yield back.
Thank you, young lady, for yielding.